Hi, I'm Jenny Jacob. I'm the lead clinical therapist in the NICU, and we just wanted to take a few minutes today to talk to you about how the therapy program is integrated into the NICU here at Banner University. So just to go over a little bit of our history, it started in 2011 with one physical therapist who was designated 24 hours a week. So that's a 3-day designation, which is a .6. And in the 6 years that the therapy program has been running, we now have 6 total therapy members. We have 3 physical therapists who make up basically a 2.0 FTE, and we have 3 occupational therapists as well who also make up about a 2.0 FTE. One of our physical therapists is a certified neonatal therapist, and one of our OTs is an IBCLC with a second OT who's actually undergoing her training for that as well. We, in addition to offering clinical services in the NICU, we also offer a developmental follow-up clinic, which was started in August of 2012. Initially, our clinic started at about 2 half-days per month, and it was run by a physical therapist, a developmental psychologist or PhD, and one of our physicians from the NICU. Now our clinic has progressed to the point where we have a weekly clinic. It's a 3-quarter day. We see 5 to 7 patients throughout that clinic, and it is run by the physical therapist, the PhD, and a neonatal nurse practitioner. We are currently scheduling out about 4 to 5 months, and so we have finally been approved for further expansion of our clinic to another 2 half-days per month. In general, this is the information on how our babies come to us for therapy referrals in the NICU. So this is a lot of information on the slide, but it's really just an idea of the types of kids that we have the capability of being able to see. We do have standing orders for therapy services, and upon a chart review, we can determine whether or not a baby is appropriate for services. So what we do is when we have an admission and the order is generated, we individually review the chart for the benefit of intervention, and then we determine whether or not the baby is eligible. About 95% of our admissions qualify for at least a therapy screening, which means a chart review and an evaluation at bedside, and then whether or not the baby would continue to benefit from services is then determined. We have, like I said, our standing PT and OT orders, and we divide who on the therapy team will take those orders based on what the needs of the baby are, whether it's a developmental intervention versus a feeding intervention. Often, both the OT and the PT will maintain orders due to the complexity of the infants and trying to approach the baby from a holistic perspective. So in general, PTs will address more of the orthopedic and positioning issues, OTs will address feeding issues, and then both of the therapies will address the developmental needs of the infant in conjunction with the NID caps that are performed by our neonatal developmental nurse specialists as well. We currently offer a variety of areas of specialization on our unit, including focus on breast and bottle feeding. We offer splinting and needs and assessment of other orthopedic issues. We do specialized developmental assessments prior to discharge that can help us determine recommendations for follow-up in the community in terms of eligibility for services. And we utilize a developmental assessment here called the TIMP, which is the Test of Infant Motor Performance. And it's a standardized assessment that we use for babies corrected from 34 weeks all the way up to 4 months corrected age. That is also the assessment when our babies come back to our developmental follow-up clinic that we continue with up until 4 months of age, and then after that we will do the Bailey. In other areas of specialization we look at chronic lung disease and the implications it has on development and feeding, including long-term hospitalizations. We do assist with the car seats and the car bed assessments, and we also offer massage training for the families. Our current responsibilities and involvement in the unit, we have a variety of activities that we're involved in. We are part of the developmental care team. In addition to that, we attend the monthly nursery management meetings. We attend discharge planning on a weekly basis. We do have developmental and feeding rounds that occur weekly with the medical team for separate reasons. So we have developmental rounds as well as feeding. We do provide education to our medical residents, and our new nurses will also shadow one of the therapists on the team for a 4-hour portion of the day. We have a variety of programs and projects that we're working on in terms of improvement of service on the unit, and that includes feeding, looking at positioning devices and products and what works best for our babies and our nurses here, as well as improving car seat safety and car seat tests prior to discharge. We are working with an external agency called ITK, or Integrative Touch for Kids, which is a therapy organization that comes in on a volunteer basis to provide stress management and support for family members and some of our babies on the unit. And we have 2 of our therapists who are adjunct faculty members for the Arizona LEND program. And then we are working within the Banner system with managers and other therapists to standardize our competencies, core knowledge, and intervention opportunities in the NICU. And that's happening all throughout Banner. In terms of areas of growth where we'd like to see us continue to go, we would like to continue to improve our work with our developmental nurse specialists in terms of what we're doing on the unit for each baby. We have some opportunities for some clinical research. We are able to and do provide presentations on both the local and national levels, and we continue to improve working on our breastfeeding rates, head shape outcomes at discharge, and focusing on some other orthopedic concerns related to prolonged hospitalization, including hip position versus dysplasia, and chest wall rigidity and shoulder retraction for our chronic lung disease patients. I'm going to turn it over now to Christina, who is our occupational therapist.
Hello, my name is Christina Arnold, and I am an occupational therapist and international board certified lactation consultant here on the NICU at Banner. So I would just like to provide you with a little information regarding what we've been working on in terms of our recent projects for feeding and nutrition and our multidisciplinary efforts to support the unit. So breastfeeding at Banner. So our therapists really try to provide ongoing support for breastfeeding starting at birth. And lactation also assists with getting our moms pumping, establishing milk supply, providing additional support for actually latching the baby on, and therapy staff provides education on feeding milestones to our families and activities to facilitate breastfeeding in the preterm and fragile infant. We have sent micro-preemies home successfully breastfeeding exclusively without any supplementation, kids born at between 23 and 25 weeks. It's a pretty incredible journey to witness, and it's a privilege to be a part of. We've been promoting breastfeeding more and more over the years, especially as research comes out supporting the benefits of direct breastfeeding in the preterm infant population. So with support and encouragement from our division chief of neonatology, Dr. Bedrick, we've been able to start a neonatal feeding and nutrition work group. We initiated this work group through identified areas of need that came to us through feedback from families and feedback from staff members on the unit. And the goal was really to support families as they navigate breast and bottle feeding in the NICU, promote direct breastfeeding in the preterm infant and medically fragile populations, provide consistent information about feeding and nutrition to parents, and promote optimal growth and nutrition throughout the NICU stay. It is a multidisciplinary work group, including an attending physician, a registered dietitian, developmental specialist, occupational therapist, our clinical lead nursing staff, and our lead neonatal nurse practitioner. So our first endeavor as part of this work group was a breastfeeding guideline to implement on the unit. It was developed by our work group. It provides a workflow for all staff, including the medical team, to support direct breastfeeding on the unit. As you may know, breastfeeding a preterm infant can be incredibly challenging and is multifactorial, really requires a team approach, and we felt that by coming from a multidisciplinary perspective, we've really been able to advocate and support breastfeeding efforts in our breastfeeding dyads on the unit. So the goals of the guideline were to create 2 feeding plans that would capture 90% of the NICU breastfeeding population, increase consistency of information given to parents by NICU staff, increase consistency of feeding plans established by the interprofessional medical team, and increase the presence of the breastfeeding mother at bedside when the timing is right, when the baby's showing consistent feeding cues and are ready to progress from kangaroo care. So we apologize for our absence during this site visit, but we're at a conference all learning and growing as therapists to try to come back and bring more to our unit. So please feel free to contact us with any questions or feedback. Our contact information is listed for you here on the PowerPoint. And thank you for your time.